Americans spend more on healthcare than any other nation. Billions of dollars, trillions even. You would think that spending so much would make us the healthiest people in the world, living the longest. But we're not. In fact, the opposite is true. We spend the most, but we live the shortest among large, wealthy countries. It sounds like a paradox, a truly broken system. How can a country pour so much money into something and get such disappointing results? This isn't just about individual choices. It's about a complex system, a system that traps millions. And once you understand it, you'll see why it's so incredibly difficult to fix. To understand this strange reality, we need to know three things. First, let's talk about the sheer scale of the spending. Imagine a single pie chart representing all the money spent on healthcare in a year. In the United States, that pie slice is enormous, approximately $13,400 per person every single year. Now compare that to other developed countries, places like Canada, Germany, or Australia. They spend roughly half that amount, around $6,700 to $7,000 per person. This means Americans spend about twice as much as their peers. That's a staggering difference. And this spending isn't slowing down. It currently eats up 17.6% of the entire American economy. That's nearly $1 out of every 5 spent in the country. This money goes to hospitals, doctors, insurance companies, and drug manufacturers, an incredible sum.
Second, let's look at what that money buys us in terms of health. Despite all that spending, Americans have the lowest life expectancy among the G7 nations. The G7 is a group of the world's largest advanced economies. America's average life expectancy currently stands at about 77.5 years. That's lower than every other country in that group. For comparison, people in Japan live nearly 7 years longer. 7 years! Think about what 7 more years of life means for a person, for a family. This isn't a small difference, it's a significant longevity gap. And this gap has been widening, not shrinking. And the third thing to understand, it's a common misconception that America's high spending is purely a private problem, that it's all out of pocket or employer-provided insurance. But that's not the full story. The American government, through programs like Medicare, Medicaid, and military health care, spends an estimated $7,000 per person on public health care. That's just the government's share. This figure, on its own, is higher than what countries like Canada, Sweden, or Denmark spend on their entire healthcare systems, public and private combined. So the idea that the US government doesn't spend much on healthcare simply isn't true. We spend a lot, publicly and privately. Now, here's where it gets truly complicated. This massive investment in healthcare doesn't protect us from health crises. The COVID-19 pandemic hit America particularly hard. It erased nearly 2 decades of life expectancy gains. That means, in terms of average lifespan, we were set back to levels seen in the early 2000s. While other wealthy nations also saw declines, America's rebound has been slower, much slower. So, we have a system that costs an extraordinary amount, both publicly and privately. It delivers worse outcomes than our peers, and it's incredibly vulnerable to public health crises. The question isn't just if it's broken, but how it became this way, and why it's so hard to fix.
To truly understand this catastrophe, we have to look back at how America built its healthcare system. It's fundamentally different from most other developed nations. Think about how most people in other wealthy countries get healthcare. It's often through a national system, funded by taxes. Everyone is covered. In America, it's rarely that simple. Our current system largely started taking shape after World War II. During the war, wage freezes were common, so companies found a way to attract workers by offering benefits like health insurance. This was a novel idea at the time.
It was a way for employers to give their workers something extra without technically raising wages. The government even made employer-sponsored health insurance tax-exempt. This meant it was cheaper for companies to offer insurance than to give people the equivalent cash. So millions of Americans started getting their health insurance through their jobs. It seemed like a good solution then. It created a link between employment and healthcare. And for decades, it worked for many people. It provided a safety net. But that's not the whole story. Here's where it gets interesting. This employer-based system created a fragmented market. If you didn't have a job that offered insurance, you were often out of luck, or you had to buy it yourself, which could be expensive. The government eventually stepped in to cover some of those left out: Medicare for the elderly and disabled, Medicaid for the poor. But these programs didn't cover everyone else. This meant that America developed a patchwork system, a mix of private insurance, public programs, and a significant number of people with no insurance at all. This fragmentation is a key driver of our high costs.
But that's not the only complication. The biggest reason American healthcare costs so much isn't necessarily because we use more services. It's because the prices for those services are astronomically high. Think about it this way. If you go to a hospital for a routine procedure, say an MRI, in America, it might cost you several $1,000s. In Germany, that same MRI could cost hundreds. The same goes for prescription drugs. A cancer drug might cost $10,000 a month here, but $2,000 in France. These aren't minor differences. These are fundamental price discrepancies. Researchers at Johns Hopkins found that for virtually every service and medication, the prices in the US are far higher than in any other developed country. Why are the prices so high? It comes down to a fundamental lack of negotiation power. In many other countries, governments or large national insurance funds can negotiate prices directly with hospitals and pharmaceutical companies. They have immense leverage. They represent an entire population. They can say, "We will pay X for this drug or we won't buy it." In America, our fragmented system means individual insurance companies or even large employer groups don't have that same power. They negotiate individually. This creates a system where providers can often set their own prices, knowing there isn't a unified buyer to push back. It's a market where the sellers often hold most of the cards. And then there's the structure of how providers get paid, the fee-for-service model. This means doctors and hospitals get paid for each service they perform, each test, each procedure. This incentivizes more services, not necessarily better health outcomes. If you're a doctor and you can order an extra test, you might. Not out of malice, but because the system is designed to reward quantity, not efficiency or prevention. This model encourages more interventions, more expensive treatments, and sometimes even unnecessary procedures. It's a vicious cycle that drives up costs. Now let's tie this back to our outcomes. Why do we live shorter lives despite this spending? It's not just about access to advanced medical technology, which America has in abundance. It's about what that money doesn't cover. Our system prioritizes treating sickness over preventing it. Primary care, which is foundational in many other healthy nations, is underfunded and undervalued in the US. Many Americans struggle to find a primary care doctor or can't afford regular checkups. So problems fester. Small issues become big, expensive emergencies. Beyond the healthcare system itself, there are also broader societal factors. Things like nutrition, education, housing, and environmental quality. These are called social determinants of health. America has significant disparities in these areas. For example, if you live in a neighborhood with limited access to healthy food or without safe places to exercise, your health outcomes will likely be worse. Even with insurance, these underlying issues affect lifespan. Our high spending often goes to complex, late-stage treatments, rather than investing in the foundational health of communities. We're patching up leaks with gold-plated solutions instead of fixing the pipe. So, here's what we're really looking at.
The American healthcare system is a unique, costly paradox. It spends roughly double what other wealthy nations do, yet it delivers the lowest life expectancy among them. This isn't just a matter of poor individual choices or even a lack of advanced medicine. It's the result of a fundamentally fragmented, high-priced, and reactive system. The problem persists because the various pieces of this system are deeply entrenched and benefit powerful interests. Insurance companies thrive on managing networks and premiums. Pharmaceutical companies benefit from high drug prices. Hospitals are incentivized by the fee-for-service model to perform more procedures, and millions of Americans rely on their employer-sponsored insurance, fearing what they might lose if the system were to change. There are competing interests, powerful lobbies, and decades of inertia.
So why hasn't this been fixed? You might be thinking, surely people see this problem. And they do. But changing it means disrupting a multi-trillion-dollar industry. It means challenging the way millions of people currently access their care, even if that access is flawed. It means tackling the deeply ingrained belief that healthcare should be tied to employment, or that it's a market commodity rather than a fundamental right. It's a system that, for all its flaws, provides some level of care for hundreds of millions of people, and the path to a better system isn't clear-cut. Now, what does this mean for us? This isn't just a dry economic statistic. It means that real people are caught in this logic they didn't create. It means a family can face bankruptcy after a sudden illness. It means a young person without a good job might delay vital care until it becomes an emergency. It means, quite literally, that Americans are dying sooner than they should. In this vast, wealthy nation, we have a profound mismatch. We have immense resources, but we are failing to convert those resources into longer, healthier lives for everyone. So, where do we go from here? The numbers don't lie. They tell a story of immense spending and disappointing returns. But these aren't just numbers. They are years of life lost. They are preventable illnesses endured. They are the constant anxiousness many Americans feel about their health and their financial future. The fundamental question we must ask ourselves is this: if we are spending more than any other nation and yet achieving less, what is the true cost of our current approach? Is it just the dollars, or is it something far more profound? Perhaps it's a reevaluation of what healthcare truly means in a society, not just treating illness, but fostering an environment where everyone has a genuine chance at a full, healthy life. And what would it take to build a system that prioritizes human well-being over profit, over fragmentation, over the incentives that currently trap us in this catastrophic cycle? The answer is not simple, but the need to find it grows more urgent with every passing year and with every life that is cut short.